Okay, so again, in my brief tenure at the NIH, I've been looking at this whole issue around infrastructure. And I guess I'm being guided by two principles. One we've been discussing all along. I'm sure you were discussing this morning, and certainly it was in the previous session around sustainability. That from my point of view, the only way whatever we do is going to work, if it's going to scale in any way, shape, the community have to be very active participants in making this actually happen. The other part of it is from my own experience in various, I guess, government enterprises over the years. And definitely, and we heard a bit about this from Hannah, that the idea of build it and they will come. I think that we've seen numerous failures over the years in how that's operated. So this sort of agile, incremental approach to experimenting with infrastructure, seeing how it works and really coming up with good metrics for evaluating it and then moving forward and evaluating it is exactly what we want to do. With respect, certainly, of course, the sources of data have a role to play in this and in terms of, say, academic medical centres. But I think where we're headed with this, and I got an endorsement to actually experiment with this over the summer, is, well, at least within the NIH context, is to experiment. So taking what I previously said into account is to really experiment with what we call the commons, which is, really to create an environment that is going to enable the community to work with a variety of data types within that framework. And we will experiment with different instantiations of that relate to the cloud and so forth. And of course, that opens up all sorts of questions about how this will operate. The basic underlying principle of how it will operate will be that there must be an associated business model for it. That is, whatever happens with it has to be effectively sustainable. So, and you can imagine in different ways how that would happen. So if this is at its simplest incarnation, a sort of Dropbox-like environment, you can prevent enormous downloads of data by having costing models that create the right balance to get information in there, but without overloading the system. So there's all these kinds of elements at play. But it seems that this is something that we want to try. And I've talked to quite a lot of people, both in the public and private sectors, about this. And there's no reason why this sort of thing the commons should be constrained to the NIH and NIH investigators. Certainly there's interest from the other agencies and even some interest, well, not even, but interest from pharma as well in actually contributing to this kind of resource. So you can imagine all sorts of discovery mechanisms and associated with having this kind of environment. Also, you can also imagine situations where you have simple drag and drop type environments where the file types that you're dropping are actually identified, and you apply some level of authentication against that data type, which then creates a piece of metadata which speaks to essentially the quality of that data as it stands at that time point, which of course can evolve. All of that can of course be defined by the community themselves to define the standards and develop the tools and the APIs to actually run against those different types of data. So it creates essentially a collective to move forward. This is also, I would say, we heard about it in the last session, the Global Alliance for Genomic Health, I think, is thinking very much in the same way. So that's sort of, in terms of infrastructure, what's the current line of thinking.